Fit for dermatoscopy. Welcome into this first series, Basics, and this first episode, short glimpse into the physics of dermatoscopy. When we look to the patients and clinically with our naked eye, we see, for example, a spot here on the right-hand side of the back, and then we take the dermoscope and we cannot look inside of the skin based on the different types of tissues. But there's a very simple trick. Now, when we take a glass plate, for example, and here with a dermoscope with 10-fold magnification, then we can have a look inside, but a very distinct look. But there is still some air between the glass plate and the skin. And here there is the next trick. We can take some immersion fluid, for example, water or olive oil or disinfection spray. So here it is the issue of the instrument. Yeah, and then we take the dermoscope and then we can look inside into the skin. And there we see special colors, special dermatoscopic features in which we know we have invasive melanoma here. So we know that we can look inside into the skin with this help of the dermoscope up to 2 millimeters into the epidermis and upper dermis. And with the dermoscope, we can increase our diagnostic accuracy up to 50% or even higher, especially in small lesions. Therefore, the dermoscope is such helpful for skin lesions, skin tumors, and also for inflammatory diseases, etc., etc. When I use the dermoscope, you can have with some contact glass or non-contact glass. Yeah, I personally use it with contact glass, but there is a limitation which I show you later on. And very important, we need the possible toggle, the switch between polarization light and non-polarization light. We call this also polarized dermoscopy and non-polarized dermoscopy. Polarization light means a reduction of scattered light at the dermal, epidermal junction and epi and upper dermis. Yeah, and in contrast, non-polarization light means a better visibility of the upper epidermis. I show you examples. Let us learn with examples. Yeah, you see these blue lesions, older patient. Yeah, with non-polarization dermoscopy, MPD. Yeah, so is this a blue nevus? But when we see this now with polarization light, PD, yeah, we see shiny white lines, and now we know we have invasive melanoma. And here, this is the example for you for the toggle procedure, yeah, non-polarization light and polarization light, yeah. And here we see the shiny white streaks, and now we know we have invasive melanoma. Next example, we see this lesion here, and I think you know this is a seborrheic keratosis, and this is non-polarization light, and here we see the media-like cysts. Yeah, and now we know this is typical for the seborrheic keratosis. And in contrast, when you toggle into the polarization light, yeah, the media-like cysts are more and less disappeared, yeah, not such as clear presented. Yeah, and now we know, and here we have the confirmation of the seborrheic keratosis. Also, this example here, non-polarization light, NPD, with the media-like cyst, eyes toggle, and I have the PD, and the media-like cysts are disappeared. So I use my dermoscope with contact glass, but we need to take care with the vessels. Do not press too high on the lesion, and we will talk about vessels later on. So non-contact glass is also possible, but I lose more information here, therefore I take it with contact glass. And with the possibility, and this is very important, to toggle between polarization light, PD, and non-polarization light, NPD. So this is very important for me when I use my dermatoscope. So these are the basics, the short glimpse into the physics of dermatoscopy. Yeah? And when we know this, it is much more easier and understandable to apply dermatoscopy on lesions. So what will be the next basics? And here's the episode, Colors in Dermatoscopy. I'm happy to see you there. Bye-bye.